多囊性卵巢症候群的临床表现与青春期女性的正常生理现象非常相似，在青春期女性月经来潮7至9年及经期稳定后做复查时，才能确认是否为多囊性卵巢症候群。通过一些症状，如雄激素水平升高、肥胖及毛发生长异常，则可列为高危群组。延误治疗或治疗不当将引发并发症，包括不孕、心脏病、糖尿病、子宫内膜癌及心理健康问题等。
Hi, my name is Dr. Jerili Azahari. I'm a consultant, obstetrician and gynecologist, subspecializing in pediatrics adolescents gynecology. To know what is considered to be irregular menses, I think the first thing we should do is to understand what is normal regular menses first. Normal regular menses is a menses that falls between a cycle of 21 days to 35 days, and anything out of this normal regular cycle is considered to be irregular menses. In other words, an irregular menses is defined as a cycle less than 21 days or 35 days or 8 menses per year. So the difference of a woman with irregular menses and a woman with PCOS is the fact that women with PCOS may not have more menses as compared to a woman with irregular menses. PCOS women usually have lesser menses. In other words, they may experience what we call oligomenorrhea, where it means that a woman would have less menses per year. In other words, other additional characteristic of PCOS is they might be a little bit overweight, with or without metabolic syndrome, which includes disease like type 2 diabetes, hypertension, or hyperlipidemia. So in terms of managing irregular menses among adolescents, it should not be compared to an adult menstrual irregularities. In adolescents, it could be considered to be normal to have irregular menses 1 year after attaining menarche or 1 year after getting her first period. The irregularity can actually continue up to 3 years after obtaining or attaining menstrual. The normality of irregular menses in adolescents after they have gotten their period could extend up to 3 years after they get their menses. If in adult women, and we consider irregular menses to have a cycle of more than 35 days, it could be absolutely normal for that to happen in adolescents. So care must be taken when diagnosing or treating adolescents with irregular menses. The potential implication of irregular menses really depends on the cause of the irregular menses itself. All in all, it is very important to first rule out pregnancy because early pregnancy sometimes can be complicated by abnormal or irregular menses. PCOS, on the other hand, a woman may present with irregular menses will have a higher risk of long-term complications such as diabetes, hypertension, and hyperlipidemia. In a worst-case scenario, endometrial cancer can set in PCOS women. Other causes of irregular menses, which include things like polyps, growing in the uterus or the cervix, if left untreated, can sometimes cause infection or turn into something more dangerous like cancers. Number one, to keep a good menstrual calendar. You can do it on your notebook, you can do it on your phone, you can do it on a lot of apps that you could download into your PC, iPad, or iPhone, for example. And document exactly when your period comes and ends, and you could document it as spottings or bleeding, and you can even insert things like pain and how you feel and how your mood is like. And number two, keep a healthy, well-balanced lifestyle in terms of your diet, the exercise that you do, and the time you spend at work and the time you spend at home as well. Be kind to yourself. When you see a doctor and when the doctor diagnoses you with PCOS, for example, the doctor will tell you to lose some weight. It's easier said than done, and I understand that. But keep trying. But most importantly, be kind to yourself.